Changing Economic World, podcast number 2 on the demographic transition model. This podcast covers a description of the changing stages of the demographic transition model and suggests some reasons why these changes occur, why having a declining birth rate in stage 5 is a problem for some countries, and describes the changes in living standards as a country would experience it moving through stages, the 5 stages of the DTM. So first of all, what is the demographic transition model? Well, demographic is another word for population. Transition means change, and a model is a projection or an example situation. So it's showing changes in population. It is based on the changes that have taken place in Western countries such as the UK. It shows changes in the birth rate, it shows changes in the death rate, and it shows changes in the total population. The gap between the birth rate and the death rate is called natural change. That natural change could be an increase or a natural decrease. A natural increase occurs where the birth rate is higher than the death rate. A natural decrease would occur where the birth rate is lower than the death rate. The total population of a country will vary in birth and death rates, and its natural change will vary over time. However, a total population is also affected by migration, both immigration, people moving in, and emigration, people moving out of the country. However, this data is not shown on the DTM. So stage 1. During stage 1, both the birth rate and the death rate are high. They're fluctuating, which means going up and down, because of disease, famine, and war. Because of this, the population is fairly low and stable, so the births and the deaths are cancelling each other out. As a country moves into stage 2, the death rate decreases, but the birth rate remains high. Therefore, the total population grows, as more people are being born than dying. Decreases in the death rate can be partly due to improvements in medical care. As we move into stage 3, the birth rate drops rapidly. The death rate continues to decrease, but more slowly. However, the birth rate is still higher than the death rate, and the total population continues to grow, although not as quickly as in stage 2. At this stage, the birth rate reduces because the death rate reduces, and improvements in both medical care and education lead to smaller families. By stage 4, both the birth rate and the death rate are low. They're fluctuating, but low. The total population is now maintained at a steady, high level. And then finally, stage 5 is the first stage where you can see a potential natural decrease. In this stage, the birth rate is very low and falls consistently below the death rate. Therefore, more people are dying than being born. That can lead to a population decrease. The death rate increases slightly because of an ageing population. So ageing populations can cause several problems for a country. as they are not normally economically independent or working and contributing to the economy. They are also not of the age bracket that would increase the birth rate and rely heavily on those of the economic working population. They may put strains on healthcare and often require more healthcare than their younger counterparts. So how does this correspond to LICs, NEEs and HICs? Generally, it is agreed that LICs are in stage 2 of the DTM. Even the world's poorest countries have experienced a fall in death rate due to global efforts to tackle hunger, issues surrounding water quality and diseases. NEEs are more likely to be in stage 3 of the DTM. Far fewer families in NEEs still live by subsistence means. This means that parents do not need to have large numbers of children to help farm the land. Improved healthcare means that contraception may be widely available, and independent working women in NEEs are choosing to have fewer children and focus on a career. Of course, there are times where the death rate of a country may temporarily rise due to a conflict, natural disaster, or it is also dependent on age. Some HICs are experiencing rising death rates due to a growing proportion of people aged 80 and over who live there. When it comes to the birth rate, some cultures may be far more resistant to cultural change or acceptance of contraceptives. Rapid population growth can lead to overpopulation where there are too many people for the available land and resources. You may now like to try one of these example exam questions. Reaching stage 5 of the DTM can cause issues for a country. Assess the extent to which you agree with this statement. Justify how you know that the UK is currently in stage 4 of the DTM.